Hello, and welcome to our demonstration on performing tracheostomy care and suctioning as performed by Jared. You would first begin by coming into the room and ensuring patient privacy. Go ahead and wash your hands and introduce yourself to the patient and perform patient identifiers and let the patient know what you're going to be doing.
Good morning. My name's Jared. I'm going to be your nurse today. Would you mind by telling me your name and date of birth? Alright, wonderful, Mr. Jones. We're going to be performing some tracheostomy care, and I'm going to use a little bit of suctioning as well. If you'll give me a moment, I'm going to go get my supplies and wash my hands.
After obtaining your supplies, return to the room. Ensure that there is an emergency ambu bag and arbitrator at bedside in case of an emergency situation where the patient's airway closes. Make sure to don clean gloves, and begin to set up your sterile field after auscultating the lungs and checking the patient's pulse ox, respirations, and heart rate to ensure they're within the normal levels of over 95%.
Alrighty, Mr. Jones, I'm back. I'm just going to start off with a quick listen of your lung sounds. Alright, and lift up. Okay.
Next, raise the bed to a comfortable level for you to perform anything in a sterile environment. Turn on your pump and make sure the hose is nearby for your clamping, and ensure that the pressure on the pump is between 80 and 120 psi. Next, begin to set up your sterile field. Whenever setting up for sterile gloves, make sure to pull the tabs away on the packaging and then towards and outwards to ensure to maintain a sterile field. You always want to make sure that you never pull away from blast. Before donning sterile gloves, it is important that you wash your hands. When donning sterile gloves, it's very important that you start with the non-dominant hand and pinch the outside with your dominant hand to maintain its sterility. Never go and take from unclean hands on the inside of the glove. On your dominant hand, make sure to pull under in order to maintain maintain sterility. If you ever need to tighten your gloves, make sure to always tuck from the outside and not the inside in order to maintain sterility as well. You are now ready to start in the sterile environment. Next, go ahead and take everything out of the sterile container that you do not need and placing it inside of the trash below. Make sure that trash can is nearby so that way you do not accidentally break sterile environment. Next, take everything out of the containers that is sterile and go ahead and put them onto your sterile environment that you will need. These will need to maintain sterile field for the remainder. It is also extremely important to make sure that the bottle of sterile water has not passed its expiration date. If it has, make sure to change it as soon as possible before you continue with the trach suctioning. Next, unscrew the cap to your sterile water and pour from the side into your sterile basin so you can clear your line later on. Next, coil the suctioning tubing around your dominant hand comfortably. After hyperoxygenating the patient to 100%, go ahead and pull off the mask. You will connect the tubing. Remember that your non-dominant hand is now broken sterile field, so you will not be able to use that. Go ahead and check the suctioning and clear the line one more time. Next, insert the tubing into the hub of the trach tube. Go all the way down until it stops. We're going to begin retracting and twirling, ensuring that the tubing does not touch any part that is non-sterile for no more than 15 seconds. Clear the line, noting any purulent drainage, and hyperoxygenate the patient for 30 seconds up to 3 minutes. After repeating this process for a maximum of 3 times, disconnect your tubing and drop it into the trash above your waist to make sure to maintain sterility. After hyperoxygenating the patient, go ahead and take the mask off and take out the inner cannula of the trach. Inspect it, noting for any discoloration or abnormal drainage. Place it into the trash using the same procedure. Grab the new cannula with your sterile hand and place it inside. And go ahead and take out your old gauze, noting for any signs of any buildup or any purulent drainage from signs of infection. Go ahead and drop it into the trash. And next, you're going ahead and grabbing your clean swab and dipping in your sterile water, and go ahead and note any sites of infection or any inflammation around your site for your trach, and go and start by swabbing from inwards working outwards. Clean off any drainage and drop it into the trash, and repeat the same process with another swab on the upper area of the trach site. Discard that and grab a clean set of gauze and dry the areas that you just cleaned. And discard. Next, grab your sterile gauze that is fenestrated, which means it has a slit right in the middle, and you're going to go ahead and, the best you can, go ahead and tuck the new gauze securely underneath the trach, making sure that the bottom portion of it facing the skin maintains as sterile as it can. Place the mask back on the patient in order to help to reoxygenate them above 95%.
Ready, Mr. Jones? Now that we're done with that, I'm just going to take another listen to your lungs, alright?
While auscultating the anterior and posterior lungs, ensure that the patient has clear airways and you do not hear any mucus buildup. If so, make sure to redo the suctioning at a later time. Make sure to auscultate the anterior and posterior bilateral lung fields as well, both the upper and the lower.
Alrighty, just lift up one more time for me. Alrighty, sounds like we did good. Alrighty, Mr. Jones, we just have one more step left. I just got to replace your trach collar, and then I'll let you be.
Before placing on the new trach collar, make sure to inspect on both sides of the old collar and note for any signs of skin breakdown, moisture, redness, or any signs of infection. If you do not have anybody available to assist you with the trach collar placement, leave the old collar on while you're putting the new one on by placing it inside of the slits. After ensuring the new collar is in place, go ahead and remove the old one. Pulling it to one side. After which you should ensure that the new collar is tightened, and making sure that one finger can fit on both sides to ensure that it's not too tight and to prevent skin breakdown the next time. Go ahead and discard all your old items into the trash. Take off your gloves. Perform hand hygiene. Lower the bed to make sure that the patient is in a comfortable position. Raise your bed rail back up. And ensure that the call light is in the correct area.
Alrighty, Mr. Jones. Here's your call light. You let me know if you need anything else, alrighty? Thank you.
And go ahead and place the oxygen mask back on the patient. And ensure that their pulse ox, heart rate, and respirations are within the normal range. Ensure patient comfort by placing the pillow that you have taken off.
Okay.
The job is now complete.
Here's your call light.
After performing tracheostomy care and suctioning, document the type and amount of secretions and the general condition of the stoma and surrounding skin. Document the patient's response to the procedure and any teaching or learning that had occurred.